scheduling, whether it's through providing them with ample opportunities to move around throughout their career, teaching them new skills. We're going to have to figure out what that looks like. And what we learned is kind of what many of us knew as gut intuition, and that throwing a monthly pizza party or bringing in donuts isn't what nurses want to feel appreciated and valued.
No
And
kidding.
while we all knew that, it felt like an easy go to instead
Yeah.
of perhaps addressing some of these more complex, deeply rooted issues.
Okay. So what would you tell leadership at a hospital or, well, I was going to say educational institution, but I think they're quite different. One seems to be preparing the nurses. Here's what you can expect when you get in the real world. And the other one's like, welcome to the real world. Here's your pizza. What would you tell the CNO at the
Well,
hospital?
so you talk about kind of a divergence there, two different worlds. I think the issue that we see in academia is that the salary is so much less. You're talking about pulling a really good nurse out of a practice environment and asking them to educate young people, maybe not even young people, right? New nurses. And that's an awful lot of responsibility. And then to pay them less than they're making, it's not attractive to people. So we continue to see a lot of positions go unfilled in academia. Now, when you flip that and you're talking about how can we improve retention on the part of the organization, I would say every single organization is different. So there are some that do this amazingly well. It means that you're going to have to spend money and do salary adjustments on a probably 12 to 18 month cycle. Maybe you get away with 2 years. Also figuring out how
Hmm.
can you create something that looks like a career lattice. So for everything they do and every additional contribution, maybe there's compensation for that. Now, I would tell you, you're going to find people, we argue amongst ourselves in nursing about this, because shouldn't a professional nurse precept and mentor and not expect to be compensated? Well, they should precept and mentor. However, it is additional responsibility. It does make their day more complicated. In some cases, it's just plain downright burdensome to have students tagging along and trying to teach them while you want to zip around and give care. So I think we have to balance what it is we're asking of people with how we're recognizing the value of that contribution.
Well, I don't know if you know Susie Cardon Egren or Lisa Marie Wan.